Conservative commentator Candace Owens made an argument for Medicare-For-All without even realizing she was making an argument for Medicare-For-All. So here's the tweet. This is so hilarious. She put out this quote saying, "The COVID vaccine saves lives, which is why the government is making it free." And she responds to that quote saying, "Kay, so explain to me why insulin and asthma inhalers cost so much money. If the vaccines are really about the government trying to save your life, why do life-saving medicines cost so much?" This is making an argument for why healthcare should be free. But here she is thinking she's making an anti-vaccine argument, when in reality, she's clearly laying out that all healthcare should be free. So this is it's so amazing to see people like this, that are... Candace Owens is a famous conservative commentator. So you'd think she'd be a brilliant mind, really know how to frame these issues in a way that puts her side in a positive light, when all she is doing is accidentally making an argument for Medicare-For-All. Now, of course, I've discussed as a Canadian with healthcare, I've discussed my experience countless times, discussed why Americans need to move to a Medicare-For-All system. This is one of the many reasons. This is the real reason why Americans file for bankruptcy. Can you guess what it is? Medical bills. 2/3 of people who file for bankruptcy cite medical issues as a key contributor to their financial downfall. Yet, Candace Owens will look at this and think, no, healthcare shouldn't be free. The vaccines should cost money. I'm not even really sure what she's arguing here, but it is so absolutely ridiculous. And you know what? Americans getting their first taste of free healthcare with these vaccines, I think it's going to open a lot of people up to the possibility, to the idea that, hey, maybe Bernie Sanders is right. Maybe Medicare for All would work. Maybe it is great. Maybe when everybody pays into the same pool through a single payer system, it benefits all of us, making healthcare free at the point of use. So as a Canadian, of course, I've gone to the doctor, countless times. I had surgery once, went to get the surgery, came home, no bills, no calls with insurance companies, no deductibles, no co-pays, nothing. I literally just went to the hospital and came back home. Same thing with going to the doctor. You show your health card, you walk in, see the doctor, you go home. That's it. Now, in Canada, we don't have pharmacare covered universally, so occasionally there are, costs associated with medicine, but we should cover pharmacare. Other countries cover pharmacare. So that's an issue with our system not going far enough. But, and even still, in that system, in our system, things like insulin is 1/10 the cost in Canada compared to the US, because we actually negotiate down our drug prices, unlike Americans. So you have here if you take just 2 seconds to look outside your border, you would realize that you need to move to a universal healthcare system, and that America is the outlier here. But people like Candace Owens apparently think that healthcare isn't privatized enough. Just absolutely hilarious. But here she is accidentally making a great argument for Medicare for All.